Make no mistake about it, this disease is killing people. Time is of the essence. And the best thing we can do for each other, for this generation and the next, and for our economy, is to get a handle on the virus by slowing the spread.
Right now at 5 o'clock, Indiana issuing a stay-at-home order and tells non-essential businesses to shut down for 2 weeks.
We're also following some breaking story out of Fishers tonight. Police on the scene at the Woods of Britain apartment complex at 141st Street and State Road 37. People living in the complex asked to shelter in place right now. Police called to the complex on a report of an armed man barricaded inside an apartment. Police say the man has been firing shots at officers. Right now, no reports of any injuries. We do have a live report just moments away. And those stories, just two of several on another whirlwind development day.
Let's start with that order to put Indiana in a lockdown mode over the coronavirus. State health officials now confirm 259 Hoosiers have tested positive for the virus. And in about 30 minutes, the U.S. task force is set to give us an update on the latest. We'll bring that to you live. And the Senate has failed for a second time to move forward with a $2 trillion economic stimulus plan.
Frustrating a lot of folks. We'll break down the latest developments throughout the hour. Our team will provide much of that coverage for you. Let's start, though, with Richard Essex for the latest on the governor's new statewide orders. Richard?
So what does this executive order mean exactly? It means for the next 2 weeks, the governor wants you to stay put unless it's essential business or you provide essential services. For the next 2 weeks, grocery stores, pharmacies, and gas stations will be open. Tuesday night at midnight, the state of Indiana will be a much different place. With a series of executive orders issued today, Governor Holcomb has ordered Hoosiers to stay at home.
It's because we're all seeing the same trends or waves coming, especially in the dense areas, but it is spreading to all counties. So stay home. Get groceries only when you need them and only buy what you need. I'm telling you, the next 2 weeks are critical.
The state is shutting down all non-essential operations. However, prisons, child protective services, state hospitals, and the National Guard will remain fully operational. Welfare and unemployment applications will be conducted remotely. If your driver's license or plates are about to expire, the governor has extended the renewal for 60 days.
This means all types of licenses issued by the state will automatically be extended by 60 days. And law enforcement officials are not going to be issuing citations for, say, expired driver's licenses or registrations.
Governor Holcomb is expecting a surge in COVID-19 patients to area hospitals. He has activated a healthcare emergency operations center that will open the supply chain for critical products.
This center will centrally inventory and provide support for personnel, supplies like ventilators, masks, goggles, gloves, and gowns, and space as we move into the patient surge for COVID-19 phase. By supporting movement and coordination among all hospital systems, we will not leave any healthcare delivery system alone in their struggle to take care of Hoosiers, both those affected by the pandemic and those with other illnesses.
For the next 2 weeks, the governor wants you to think about every time you go outside the house, is it essential? You can get outside, walk the dog, work in the yard, but limit the number of people in your house to the people that live there. In downtown Indianapolis, Richard Essex, Wish TV, News 8.
Richard, thank you very much. Indiana now one of at least 13 states with a shutdown order. News 8's Leah Hodges has reaction to the governor's decision.
Downtown Indianapolis and other parts across the city will continue to look like a ghost town as Governor Holcomb says the next 2 weeks will be a crucial time in helping slow down the virus. From restaurants to schools, many places have already closed down. The stay-at-home order is taking effect when some people were hoping things can get back to normal. It starts Wednesday morning until April 7th. Some visitors News 8 spoke with say they want to travel back home before it begins. Mayor Hogsett and the Marion County Public Health Department are also pushing this order. People are only allowed to travel for mandatory work and meet essential needs. Food carryout is still allowed at bars and restaurants, including alcohol. A few businesses tell News 8 the governor's decision is a plus and it will help increase sales. One DoorDash driver says she's looking forward to the rise in deliveries.
They're protecting all of us. They mailed us out hand sanitizers. We could also get gloves. They have no contact delivery where we're allowed to sit the patient, the person's food on the porch, and they can come out and get it, so we don't have any contact with them.
The stay-at-home order is forcing people to social distance themselves from others, something everyone will have to do for some time. For a list of questions and answers related to the stay-at-home order, visit our website, wishtv.com. Reporting in downtown, I'm Aaliyah Hodges, News 8.
Aaliyah, thank you very much. Indianapolis Mayor Joe Hogsett upgrading Marion County's travel emergency to a warning level tonight. It's the highest level allowed under state law. It means no one should travel unless it's an emergency or essential. The mayor also ordering all non-essential businesses to close as soon as possible and no later than 11:59 tomorrow night.
All right, so exactly how will this order be enforced?
Yeah, so we sent iTeam8 to get answers. Want to bring in Stephanie Zeppelin now with more. Steph?
Yeah, Mike, Phil, we reached out to several police agencies, including Indiana State Police, to find out exactly what they plan to do starting Wednesday. Indiana State Police tell me they'll work with local law enforcement to make sure everyone complies. Now, what exactly that will look like? Still up in the air. No one could tell us what kind of citation there might be for those who don't comply. We also reached out to Carmel Police, where they've already had similar restrictions in place from their mayor. They said they haven't had to enforce it because people are voluntarily complying. The department's response will focus first for IMPD on educating residents about those orders and what steps they can take to practice social distancing and keeping their families healthy. If a situation requires enforcement, IMPD says they're going to do so to protect public safety, and they may issue a citation. But the stay-at-home order is not the only thing Governor Holcomb announced today. Take a look.
Today, I signed an executive order that instructs the ATC to suspend any and all food and beverage licenses for those who violate the order.
Who don't abide by the carry-out-only rules. The Indiana State Department of Health and the Alcohol and Tobacco Commission will enforce the restaurant and bar restrictions. The city of Indianapolis only had a handful of reports of restaurants not following that order so far. Now, we've seen some posts on social media, as you have, about the National Guard's role in this. We've talked to them and the state police, and the National Guard has no role in enforcing these rules. The Guard's role is helping with logistics, such as delivering medical supplies to hospitals. Stephanie Zeppelin, iTeam8.
Good perspective, Stephanie. Thank you very much. So we've posted a full list of questions that you might have about the governor's orders on wishtv.com. And here's one. Can I take my kids to the park? The answer, yes and no. State parks will remain open, but welcome centers, inns, and other buildings are closed. Families can go outside, take a walk, take a run, or go biking, but you should continue to practice social distancing. Playgrounds, on the other hand, will remain closed.
Healthcare workers have been in line most of the day for drive-through coronavirus testing here in Indianapolis. The testing site at Lilly is not open to the general public, but as News 8's David Williams reports, there's a good reason for it.
Lisa Yancey works in the trenches of the COVID-19 fight as a nurse.
I work labor and delivery in Indiana and also San Francisco, and I just came back from there after 2 weeks, so I feel like there's definitely a risk of exposure.
Which is why she came to Lilly's first day of free drive-through COVID-19 testing that is only for active Indiana healthcare workers. This includes physicians, nurses, pharmacists, and other healthcare professionals, and they must have a doctor's order for the test. Why? Because healthcare workers like Yancey are on the front lines.
I feel like I'm healthy in general. I would probably be okay if I were positive, but I just don't want to expose older relatives, patients, other nurses.
Monday, News 8 saw this electronic sign at the entrance telling people in line to stay in the car with the windows up.
A spokesperson for Eli Lilly tells me they hope to test up to 1,000 people a day once they get up and running smoothly.
Indiana's State Department of Health tells me ISDH is exploring all options for expanding testing, and any drive-through or mobile events have been run at the local level. Hancock County's Health Department office manager tells News 8 they don't have plans to open a drive-through COVID-19 test site, but Hancock Regional Hospital offers a COVID-19 clinic. Hamilton County's Health Department Administrator Barry McNulty tells me they are in a holding pattern, waiting on COVID-19 test kits and guidance from ISDH about opening drive-through test sites for Hoosiers. Johnson County's health director tells News 8 they need test kits and a lab, but are scouting for drive-through COVID-19 test locations as we speak. For now, Yancey's in a wait of her own.
I hope I'm negative for sure, but I would rather know.
These drive-through COVID-19 test results come back in 1 to 3 days via an online portal. People's doctors will also get the results.
A Lilly spokesperson tells me the company is looking at opening up testing to the public in the future, but there is no timetable on that. In Indianapolis, I'm David Williams, Wish TV, News 8.
All right, Dave, thank you. Another immediate concern for healthcare workers, a shortage of what is called personal protective equipment.
Yeah, News 8's Sarah Hignite spoke to 3 nurses on the front lines of the virus fight.
We spoke to nurses who work in the top hospitals in Indianapolis. Now, we protected their identity so that they could speak freely on how they're being asked to treat the virus and what it's like inside of hospitals during a global pandemic. Hospital staff are at risk daily of coming into contact with the coronavirus as they continue to treat patients. One of the most frustrating parts of this process for the nurses we talked to is that not everyone is respecting the CDC recommendations. Not only is this putting the patient at risk, but also other people who are in the hospital for non-coronavirus related emergencies. Nationally, a large concern for healthcare workers is the lack of personal protective equipment. Hospitals in Indianapolis are also seeing that shortage, and some nurses feel that the requirements for what they need to be wearing changes based on availability.
It's not something that I'd be risking my family for, going to work every day to come home and see you at TJ Maxx shopping. That's not fair. If I'm going to work and I'm following the rules, then you should too.
If you can breathe and you don't require medical intervention to breathe, please stay home.
Testing centers are getting overwhelmed and tests are coming back in 7 to 10 days instead of 4 to 5. Coming up at 6, hear more from these nurses and what they say their biggest fear is during the fight against the coronavirus. Reporting, I'm Sierra Hignite, Wish TV, News 8.